Today I will be demonstrating the functional in-sitting test, otherwise known as the FIST. The FIST is a clinical examination of sitting balance designed typically to be conducted at a patient's bedside. It consists of 14 everyday functional items as examination tasks. The FIST is best suited for patients with the ability to follow simple directions but have safety issues in sitting, slow movement, poor seated motor control, or inability to perform other standing balance testing. Some of the items have been grouped together for convenience. Okay, so in this video we're going to be doing a demonstration of the FIST, or the function and sitting test. So the first thing we're going to do here is we're going to make sure that the patient scoots forward to where only about half of their leg is hanging off the table. And we're going to go ahead and test some reaction by giving. To begin, I will be performing an anterior, posterior, and lateral nudge. It should be noted that these tests were only grouped together collectively for convenience of the video's sake, and that these should be dispersed throughout the exam to ensure that the patient is not anticipating. This is used to test APR of each patient. Scoring would include a 4 to a 0, 4 being a patient can perform without any abnormalities. 2 would be upper extremity support. A 3 would be performance with verbal cues, and a 1 would be needing assistance, and a 0 would be the patient is unable to perform. Anterior nudge to the sternum. Okay, then we're going to do a lateral or a posterior, and then a lateral. Very good. Next, we will be observing a patient's ability to sit with their eyes open in static position. The scoring would be 4 if they're independent, 3 with verbal cues or increased time, a 2 if the patient cannot maintain upright posture without using hands for the full 30 seconds, a 1 would be that the patient requires moderate assistance to keep statically sitting for the full 30 seconds, and a 0 would be unable to perform. Next, what we're going to look at, we're just going to look at the patient sitting with his eyes open comfortably for 30 seconds. Alright, 30 seconds goes by, no noted difficulties. Next, we will be sitting, shaking their head no. This is to test the patient's ability to remain in static seating position while utilizing the VOR. A 4 would be a normal performance. 3 repeatedly needs cueing to rotate the head fully, even just in one direction. A 2, the patient can perform a right cervical rotation fully, but left must use a hand or on a second attempt. A 1 would be requiring assistance to maintain upright balance during rotation, and a 0 is inability to perform. Or abnormalities there. Now, Lance, I want you to sit and shake your head no. Also looking for any abnormalities there, none are noted. Next, we will perform static sitting with eyes closed to test for vestibular deficits that may be in sitting. A 4 would be normal performance. 3 would be knees cues, keep eyes closed. A 2 would be the patient must use hands to maintain upright position, and they need 2 or 3 attempts to ensure hands are required. And a 1 would be the patient cannot sit for the full 30 seconds. The eyes closed, and the 0 is inability to perform. Next, we will perform the sitting while the patient lifts the foot 2 inches above the ground. This is the test for the patient's ability to perform an APA for movement while maintaining static balance. A 4 would be normal performance. A 3 would be performance is slower than normal, even with repeated attempts. A 2 would be on attempts to still need hands on our second attempt, or on the second attempt to complete. A 1 would be the need minimal assistance to lift the foot off the ground for the 2 inches, and a 0 would be inability to perform the exam. No noted abnormalities there. Now, what I want you to do is lift your foot up 1 inch from the floor on your right foot twice, your dominant foot. Very good. And there we're looking for any noted abnormalities with his balance or his ability to perform an APA. Next, we will be picking up an object from behind and from the floor. It is noted that these are combined only for the convenience of the video. And picking an object up from behind, you place it midline, and the patient would reach backwards with their dominant hand to grab the object. The purpose of this test is to have the patient to rotate their trunk and to maintain static balance while doing so. A 4 would be normal performance. A 3 would be the patient requires cues to rotate the trunk to reach the item, otherwise normal performance. A 2 would be the patient must use hands to stabilize themselves to achieve the trunk rotation. A 1 would be moderate resistance, and a 0 would be inability to perform this test. And picking the object up off the floor is a similar idea. The patient may use either hand to pick up the object from the floor. 4 is normal performance. A 3 is multiple attempts requiring prompting. A 2 cannot return to sitting with use of hands, even on repeated attempts. A 1 is minimal assistance required, and a 0 is the patient cannot perform this task. Okay, next what I want you to do is picking up an object from behind. Use this. So using your dominant arm, once you reach behind you, pick up an object. Excellent. Now, I'll put it between 2 feet. I want you to be able to reach down and grab it. Also, no noted abnormalities there. Now, next we will be performing the forward reach segment of the test. This is to test for the patient's ability to contract the abdominals. And it should be noted that the patient should make contact with the anterior thighs before returning, and they may use their dominant arm. Scoring would be 4 would be normal performance. A 3 is they move tentatively or excessively slowly but can complete the task. A 2 is the patient uses hands even on the second attempt with cueing. 1 is minimal assistance, and 0 is inability to perform. Lateral reaching will also be performed during this test for convenience sake. The patient should be able to reach with their dominant side while clearing the contralateral ischial tuberosities. Scoring for this patient, the scoring for this portion would be normal performance as a 4, 3 with slow movement or cues. 2 would be must stabilize by using balance with other hand. 1 requires assistance, and 0 inability to perform. What I want you to do is I want you to reach forward as far as you can. Very good. And now reaching out to the side with your dominant arm, I'm going to be looking for clearance of the ischial tuberosity on the contralateral side. Very good. And lastly, we will perform the anterior, posterior, and lateral scooting. Scoring for these will be the same. For the anterior, posterior, and lateral scooting, patient should be able to scoot at least 2 inches to score a 4 on performance. 4 would be normal performance. 3 would be excessive time or excessive scooting motion required. 2 would be upper extremity support to complete the 2-inch scoot in each direction. 1 would be moderate assistance to complete the scoot, and a 0 would be the patient cannot perform the scoot. And lastly, what I want you to do, Lance, I want you to scoot forward. Just trying to scoot yourself forward. We're going to scoot backwards and then side to side. Very good. Very good. Very good. Very good. No noted abnormalities there. Great sitting balance and strength. So this patient would get a score of 56 out of 56. It's perfect, which is what we're looking for. Looking at the scoring and interpretation of the fist, to recap, this is a great test that is used for patients that maybe have NMS, post-CVA, TBI, vestibular issues, or perhaps Parkinson's. This is a great test to look at in those populations that may be unable to perform a static standing test or functional test like a FGA or a DGI. This test is scored out of 56 and has an MCD of 5.63. This is a great test to be able to gauge change over time as patients become from acute strokes to chronic post-stroke, and to gauge their their improvements over time.